1 in 5. I want you to think about that number for a second.
That's how many adults are walking around with shoulder pain right now. It is so common, and it can be incredibly disruptive. But here's the most important thing I'm going to say today. For the vast majority of people, there is a clear, effective path to getting better, and it does not involve surgery.
So, welcome. We are here to pull back the curtain on what's called rotator cuff-related shoulder pain. Our goal is to give you the knowledge you need to really take control of your own recovery.
All right, so here's our game plan. We've got 6 chapters to walk through. We'll start with the basics, what the rotator cuff even is. Then we're going to tackle a huge myth about scans. After that, we'll get into why exercise is your absolute best tool, map out what your recovery looks like, touch on some other treatments, and finally, connect it all to your overall health. Let's do it.
First up, Chapter 1. What exactly is this thing that causes so much grief? It's time to really understand the engine that drives your shoulder.
You know, the rotator cuff isn't just one single muscle. It's actually a team of 4 muscles and their tendons working together. And they have 2 incredibly important jobs. First, they act as the main stabilizer, kind of like a steering system that keeps the ball of your shoulder centered in its socket. And at the exact same time, they're the engine, powering all those movements like reaching up into a cupboard or throwing a ball.
Now, you've probably heard the old term impingement syndrome. The idea was that something was literally getting pinched in the shoulder. But, our understanding has really moved on. We now prefer rotator cuff-related shoulder pain because it's a much more accurate description. It acknowledges that the pain is usually more complex and not just from one single thing being squished.
And that idea perfectly sets us up for Chapter 2. Because once you understand that pain is complex, you start to see why a scan isn't always the answer. The truth is, your pain isn't always what it seems on a picture. I mean, it makes perfect sense, doesn't it? Your shoulder hurts, so you think, I'll just get an MRI or an ultrasound, and that'll tell me exactly what's wrong. But it's not quite that simple. Okay, get ready for this because this statistic is a real eye-opener. Up to 80%, 80, of people over the age of 80 have rotator cuff tears that you can see plain as day on an MRI, and yet they have absolutely zero pain. What does that tell us? It tells us that many of these abnormalities are just normal parts of aging, kind of like gray hair or wrinkles, but on the inside. They're not automatically the cause of pain.
This real-world story just drives the point home. So you've got a 64-year-old man, classic shoulder pain. He gets an ultrasound, and sure enough, it shows a shoulder problem. So for 3 months, that's what everyone focused on. But here's the kicker. His pain just got worse. It wasn't until a clinician did a proper hands-on physical exam that they discovered the real source of the pain was actually coming from his neck. Once they treated his neck, he made a full recovery. The lesson here is huge. A good clinical exam is absolutely irreplaceable.
So, if a scan can be misleading, what's the real answer? Well, that brings us right into Chapter 3, and what is, without a doubt, the most powerful tool you have for getting better.
This right here is the headline. This is the single most empowering message from decades of scientific research. For most people with rotator cuff pain, a smart, well-designed exercise program gives you results that are just as good as surgery. Let me say that again, just as good as surgery, but without all the risks, the cost, and the long recovery.
And when we say exercise, we're not just talking about mindlessly lifting weights. A great rehab program is so much smarter than that. It's about retraining your brain and muscles to move well again. That's motor control. It's about building a solid foundation at your shoulder blade for your arm to move on. It's about restoring your full range of motion. And then, yes, it's about progressively getting stronger to build real, usable capacity for your life.
Now here's a massive mental hurdle we need to clear. People always ask, but is it okay to exercise if it hurts a little? And the research is really clear on this. Yes. A little bit of a manageable ache, one that doesn't flare up and settles down within a day or so, that's not a sign of damage. That is the sign of your tendon adapting and getting stronger. It's part of the process.
Okay, let's move on to Chapter 4 and actually map this whole thing out. Because recovery isn't just one long, confusing journey. It happens in phases, and understanding those phases can make everything feel way more manageable.
So here's the roadmap. In Phase 1, when things are really sensitive and irritable, the only goal is to calm the system down. That's it. Then you move into Phase 2, the rehab phase. This is where you start to methodically build back your strength. But, and this is so important, you can't stop there. Phase 3 is the performance phase. This is where you build true resilience so this problem doesn't just come roaring back later.
All right, Chapter 5.
We know that exercise is the foundation. It's the main event. But what about all the other treatments you hear about? Let's take a balanced, honest look at the options out there.
Let's just break these down. Cortisone shots, they can give you fantastic short-term pain relief, and that can open up a window to actually start your exercises. But repeated use can weaken the tendon over time, so you have to be careful. PRP injections, well, the jury's still out. There's some promising research, but it's definitely not a first-line treatment yet. And things like ibuprofen, sure, they can help take the edge off in the beginning, but they're not a long-term solution. For any of these more advanced injection options, you really want an expert's guidance. Someone like Dr. Kuwinder-Schrau, who uses ultrasound to make sure injections are delivered exactly where they need to go, can help you weigh the pros and cons for your specific situation.
And for our final chapter, let's zoom all the way out. Because your shoulder isn't living on an island. Its health is deeply, deeply connected to the health of your entire body.
Big studies have found really strong links between rotator cuff problems and these other health factors. Things like smoking, obesity, metabolic syndrome, and type 2 diabetes, they all create an environment inside your body that can make tendons weaker and harder to heal. Now, this isn't about pointing fingers or making you feel bad. This is about empowerment. It means that working on your overall health is a direct way of treating your shoulder.
And that's exactly why having a whole team in your corner can be such a game changer. You might have a chiropractor or a physio working on the joint mechanics, a kinesiologist guiding your exercises, and a naturopathic physician helping you tackle those bigger metabolic factors. When they all work together, they're treating the whole you, not just the sore spot.
Phew, we have covered a lot of ground, so let's bring it all home. What are the absolute most important things you need to walk away with? Here's your 6-point guide to recovery.
Let's just run through these one more time. Number 1, a good hands-on evaluation beats a scan every time. 2, the huge majority of people get better without surgery. 3, exercise is your number 1 most effective treatment. 4, injections can help, but they have a very specific, limited role. 5, your general health is your tendon health. They are one and the same. And finally, number 6, and this might be the most important, recovery is a process. Don't make the mistake of stopping just because the pain is gone. That's when you build real, lasting strength.
We've laid out the science, the evidence, and the roadmap. The path forward is clear, and for most people, it's something you can absolutely achieve. The only question left is, are you ready to take control?